Hi, everyone. My name is Lee Ryan. I actually am not part of the AGA CNP program. I'm part of the FNP track. This is actually just an elective for me. So the first question is going to be a little different for me than it is for you guys. I was a little back and forth originally, but I was trying to decide if I was going to do acute or family for the NP track. And ultimately, I decided on family because I work in the emergency room and I love working in the emergency room. I hope to work there as an NP. But I would like to work at a small community hospital and they see peds. So unfortunately in the adult geriatric program, you're not allowed to see peds. You have to, I'm actually not sure the process, but you have to go through a few more hoops than you would as an FNP. As an FNP to practice in the ED, I just eventually would have to get an emergency certification. So that kind of brings me into what my dream job would be. I don't think that I would do that right out of school. I currently practice as an emergency room nurse right now. I'm in the middle of my first travel contract on Nantucket. So I think I likely would just stay per diem as a nurse in the emergency room and try to get some experience as an NP, either in an outpatient setting or an inpatient setting. When I was a new grad, I worked on a transplant floor in Boston, and they have both inpatient and outpatient FNPs that work alongside with surgery and kind of manage the care of the pre and post transplant patients. I loved that job and it was really nice to work with the NPs. So I think that is where I would ideally like to start a career as an NP, but still really trying to decide. A question that I hope this class will answer for me. I'm interested to work with a lot of the AGA CNP students. I didn't realize when I picked this elective that it was part of your base curriculum. So I'm hoping that maybe you'll kind of answer my career questions as I work alongside you and see maybe if I picked the wrong path. Other than that, I'm looking forward to working with you guys and talk soon. Thanks.